Guys, so today we are going to see the OET pattern. Okay, so as I have told you, the full form of OET is Occupational English Test. So today we will see the pattern of OET exam, especially for nurses. Okay, so first of all I want to tell you that OET exam is consist of four sub tests. Okay, so the four sub tests are: first one, that is listening; second one, that is reading; third one, that is writing; and the last one, that is speaking. Okay, so we will see everything in detail one by one. Okay, so first one, that is listening. Okay, so the listening is for 42 marks. Complete listening test is for 42 marks. Okay, so again the listening is divided into three parts, that is part A, part B, and part C. Okay, so first we will see the part A. Okay, so listening part A, it is consist of two monologues. Okay, so each will be having 12 questions in each monologue. 12 each means total 24 questions will be there. Okay, so these questions will be like gap filling type of question. And what you will hear in the audio, you will hear that a conversation between a doctor and a patient. Okay, and your answers will be from the patient's conversation. Okay, so what patient is telling, you will be having answers according to that. Okay, so you have to follow the conversation, you have to follow the sequence. According to that you will get your answers. Okay, so 12 plus 12, 24. Okay, so this will be there in part A. Okay, so then, and next, that is listening part B. Okay, so listening part B, that is consist of about 6 monologue. Okay, so each monologue will have separate question. According to that you have to answer each monologue. You will hear a audio for one monologue, and you have to answer according to that. Then you will be having next monologue, like this 6 monologue you will be getting, and you have to answer for each, and it is like MCQ type of question. Okay, so according to that you have to answer your questions. So this is the part B. Then we will see next, that is part C. So part C, you will be having two presentations or interviews. In each presentation or each interview, you will be having 6 question. Okay, 6 plus 6, 12 question, total 12 question. So there will be no gap in between. It will be a continuous interview, or it will be a continuous presentation, and you have to follow the sequence. You have to follow each question. According to that you have to answer. And again here the MCQ type of questions will be there, and you have to answer according to that. And it is quite difficult, but it's not like you can't do it. You can do it if you will practice properly. Then definitely you can do this. Initially you will see that it will be very difficult, you won't be able to follow the sequence. But how you do your practice daily, then day by day you will be having familiar with the voices, and you will be familiar with the structure, and again you will be doing good in your OET listening. Okay, so don't get scared how it will be going. It is not that much tough, but you can do it if you practice properly. Okay, so this is part A, B, and C of listening. So next we will see part next subtest, that is reading subtest. Okay, so in reading also, again it is divided into part A, part B, and part C. So in reading part A, you will be getting a passage. Okay, so one passage will be there. In that you will be having four sub passages. Okay, so topic will be same. For example, there can be a disease condition. For example, like we will see a fracture. Okay, so in that four sub paragraphs, how it will be: in first paragraph they may be telling introduction, definition, types of fracture, and in next paragraph there can be investigation, diagnosis, and in next paragraph there can be management, and last paragraph there can be a nursing management. So like this way they will be dividing. Okay, so sometimes medical management can be there. They may be having like table maybe there in third paragraph or second paragraph, like this can be there. Okay, so you will be having 20 questions in part A. Okay, so you have to find all these answers in this paragraph. Okay, from this paragraph only you have to answer, you have to search and you have to answer them, and you will be having only 15 minutes for this. Okay, initially you will find difficult, but day by day when you practice it will be easier for you. Okay, so you have to do the practice for that. In coming videos I will be explaining you the tricks, tips, and how to solve all these things. Okay, so for now you just know how the pattern is. Okay, so in 15 minutes you have to answer 20 questions, and these questions are like gap filling type of questions and short answers, like this type of questions you will be having. Okay, so this is part A. Then we will see the part B. Okay, reading part B. Reading part B, that is again same like listening. There will be six small paragraph, and each paragraph will have a separate question, and you will be having separate MCQs for each. Okay, so this is again MCQ type of question. You have to find the answer from the given paragraph. Okay, it will be like small paragraph, and from that paragraph only you have to answer. So it is quite a little bit easy, because you will be having small paragraph for each question, and you know that answer is from this paragraph only, so it is little bit easy. You can find the answer from the paragraph. Okay, so six questions will be there like this. Okay, in part B. Then next, that is part C. Then again part C, there will be a big paragraph. Okay, so you will be having two paragraph for this reading part C. Okay, first paragraph and second paragraph. And here you will be having a presentation in written research study will be there. This type of paragraphs will be there, and you have to find the answers from these paragraphs. Okay, so here you will be getting 8 questions for each paragraph. 8 plus 8, that is 16 questions. Okay, so again this reading subtest is also for 42 marks. Part A is for 20, part B is for 6 marks, and part C, that is 8 plus 8, 16. Total, that is 42 marks. Okay, so you have to follow according to this. Okay, so reading is quite a little bit difficult from other subtest, but it is not impossible that you can't pass. You can pass, you have to practice properly, then definitely you can pass your exam easily. Okay, so this is about reading. Next, that is about writing subtest. Okay, so the writing subtest, you have to write a letter in this. Okay, so how usually when you work in your hospital, um, we usually do this part. Okay, a letter writing, but not like OET letter. When we get a patient from any other hospital to our hospital, so usually in that doctor will write a refer letter to our hospital. So there will be details of patient in that letter, and everything will be there same like that, but you have to elaborate the letter. Okay, you have to make the letter like a story. You have to write the letter like a story. Everything you have to include in the letter, and it will be like a good letter, OET letter. You have to follow some structure, and you have to do the organization of your letter, and it is not that difficult, but if you practice properly, definitely you can do best. Okay, so this this writing test, it is again for um, then you will be getting a case note, and in case note you will be getting all the type of detail in that. And after that, when you will get time to write your letter, that is for 40 minutes. Okay, you will get 40 minutes to write your answer, means write your letter, and you will get 5 minutes to read your case note. Okay, so when you will get your time to read your case note, that time you can't write. Okay, after 5 minutes only you can start writing your letter. Okay, so that is for 40 minutes. Within 40 minutes you have to write your letter. Okay, so for example, we will see it can be a referral letter, sometimes it can be a discharge letter, sometimes it can be a transfer letter, and there are so many other types also that we will see in coming videos. Okay, so according to this, you have to follow the pattern and you have to write your letter. So you have also you got it? Only you have to write a letter in part of writing subtest. Okay, so next subtest, that is speaking. Okay, so everybody think that speaking can be very tough or difficult, but don't worry, it is not that difficult or not at all tough. As we are nurses, we have habit to talk with patients, we have habit of communicating with the patients, we have habit to give health talk to patient, and we know how to talk with the patient, and in speaking text we have to do that only. Okay, so what is there in speaking test? There will be a role play. Okay, so you have to do two role play. Okay, so and before that you will be getting some warm up session. Session that is not accessible. Okay, they will not assess how you perform in your warm up session. It is just to have comfortable with your interlocutor, and you have to be comfortable. For that only it is there, warm up session. In warm up session, what they will do, they will just ask few questions related to your profession, related to your um, no, OET and everything. Okay, so they may ask you introduction, means they may ask you introduce yourself or why you choose OET, who is your role model, and like this type of questions will be there in warm up session. And after that you will be getting a cue card. Okay, in cue card you will have everything in detail what you have to tell about. There will be a scenario, there will be points what you have to talk about, and everything will be there. Okay, so according to the cue card only you have to do your role play. And in role play, interlocutor will be a patient and you have to be a nurse, and according to that you just have to do the natural scenario. Okay, you have to assume that this is a real situation, and according to that only you have to do the role play, and you will get two role play. And before starting your role play you will get 3 minutes to prepare your role play, to prepare how you will be doing your role play, what all points you want to cover in that, or sometimes how you will start introduction. Then this type of things you can do in that 3 minutes. You can read your cue card properly, everything you can do in that 3 minutes. Okay, and after finishing that 3 minutes you have to do your role play within 5 minutes. Okay, so only for 5 minutes you have to do the role play. When you will finish your first role play, immediately you have to do your second role play. Then in second role play again, 3 minutes time for preparation, and for 5 minutes you have to do the role play. Okay, so this is the type of speaking test. Okay, so like this way you have to do your speaking. So so I told you OET exam is consist of 4 subtests, that is listening, reading, writing, and speaking. And for reading and listening you have to get 30 marks. Okay, out of 42, at least 30 marks. If you will get 30 marks, then definitely then you will get a B grade, which is which is mandatory for any country where you want to work. Okay, so you have to get B grade. For that, how much you have to score? 30 and above 30. If you will get 28, 26, so that is not acceptable. Okay, so for that you have to practice properly, then you have to get 30 and above 30 marks. Okay, and this is the structure of OET exam. According to this you have to follow and you have to do your OET exam. Okay, so I hope you have understood everything. If I have done any mistake, please forgive me, or comment me in comment box so I will improve myself. Okay, so I just want to convey how the structure is and how the pattern is, so you can understand how the exam is, and before doing your preparation you should know how the pattern is. So go through the pattern and then do your test properly. Okay, so I hope everybody have understood. If you like my video, if you like my content, please give like, and please subscribe my channel. So thank you so much for watching my video.